Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Welcome to the Doctalk show. Dr. NAGADYA Catherine is my name. I am your modulator this evening. In the studio, I'm hosting Dr. ANONYA DEBORAH, the proprietor of DEBORAH Dental Clinic in Kisasi. We are having a very, very wonderful discussion this evening. We are going to be talking about cosmetic dentistry. We are going to talk about how to achieve that beautiful smile. Another way of Okwetega, right? Yeah, so we are going to talk about what do we do for your missing teeth, what do we do when your teeth are discolored, if you have cracks, if you have missing crowns, things like that. The things that we are able to do in Uganda so that you can achieve a perfect smile and improve the way you feel and the way that you look. Dr. ANONYA, kindly introduce yourself to the
Thank you so much, Doctor. Yes, viewers, good evening. I'm Dr. DEBORAH ANONYA, like she said. I am the dental surgeon and proprietor of DEBORAH Dental Clinic in Kisasi. Also the dental surgeon, Kayunga Regional Referral Hospital. Yes, like you said, cosmetic dentistry means a lot. Many people may not know it, but many people have problems with their confidence. Many people have problems with their looks.
Yes.
Many people are not happy with the way they smile. You know, in life, when you smile, it's like you're saying hello to someone, but if you don't have that beautiful smile, there's a way someone's confidence is not as good as someone who would have a sparkling smile. So that's why we are here to discuss what exactly is cosmetic dentistry or beauty in smiles.
Wow, thank you so much, Dr. ANONYA, for that wonderful introduction. I am really, really excited about cosmetic dentistry because usually, just like the appearance of a home, it gives you an imagination of what you would expect. So if I give you a beautiful smile, you can actually consider me to be a very beautiful person on the inside, right?
Yes.
It can be a way of opening up conversation. It can take you into places, but also it can get you to get married, right? Yeah, we've had stories of people who have not married other people just because they don't have that beautiful smile. Yes. So really, this is very, very important, and we would want to know what exactly do you do when it comes to cosmetic dentistry? What is this smile really about, and how can we achieve this perfect smile?
Okay, thank you. Well, cosmetic dentistry is just a branch of dentistry.
Yes.
You know, dentistry is like a science that deals with the smiles, the teeth, the surrounding tissues, and everything to do with the mouth. Now, in dentistry, there is the cosmetic of it, the beauty of the dental.
Yes.
It is just a branch of dentistry that helps to sort someone's smile in order to improve their confidence and how they look at themselves. So it is basically the reason some people come to improve their confidence. You might find someone is a model, but what is lacking about them is that smile. And your smile says hello before you do.
Very true.
You notice that?
Very
before
true.
you even utter a word to greet someone, just a smile will tell someone if they are welcome or if they are not welcome. So there's something more about a smile than just the teeth.
Yes.
Than just the look. How are the teeth organized? Are they crooked? Do you have half of your teeth in the mouth? Some people are so okay with teeth that are broken, but when someone comes to us and says, "Doctor, I'm not happy with the way I'm smiling. I've been voted to go and represent people in this, but I can't smile. I am a PR,
Yes.
Public relations. My job is to talk.
Yes.
I keep talking to people. But how can I flash my smile when my teeth are brown? So such people come to us, and the options we give them is what you would regard as cosmetic dentistry. In other words, in simple terms, it's beautifying someone's smile to improve their confidence and how they look at themselves. You find people with like the entire smile, when they smile, you just see yellow. And yet, normally, the normal teeth are cream or off-white.
Yes.
But this particular person is coming to you and they say, doctor, am I just different from everyone? Why is it that my teeth are yellow and yet normal people have white teeth?
Yes.
So all those are reasons for cosmetic.
visiting you, yes. And I've also seen some people who have, when they usually smile, their gums, you see more of their gum than their teeth. Is that actually a problem that people visit you for cosmetic dentistry?
That is a natural problem. You know, our smile, when we smile, it is the teeth that show, plus the gums. The gums are the soft tissue that everyone knows. But you might find that some people naturally have extremely bigger gums.
Yes.
Or the upper jaw is slightly bigger than the lower jaw. And such people, when they have a wide smile, the gum shows more than the teeth. Those are the people we say the person has a gummy
smile.
A gummy smile.
Okay.
So the gums will show more, and sometimes they will come to us and say, is there a way I can reduce my gums? But when the problem is more physical, like it's a bigger problem that sometimes might even require surgery, or just a simple, we call gum contouring, you reduce on the gums to expose the crown. The crown is the white part of the teeth that is exposed in the mouth.
Thank you so much, Dr. Anonya. And as you are explaining about the so many examples of the reasons to why people actually visit you for cosmetic dentistry, I see these problems very prevalent here. I see people everywhere I turn. There are people who are either missing some teeth, their teeth are deformed, they have cracks, they have missing parts. And I'm wondering, on a scale of 1 to 10, how many patients do you see in your practice who come to you when they want their smile to be worked on?
On a scale of 1 to 10, we'd look at 5 to 6. Many come in, but most times these replacements and cosmetic dentistry is not cheap.
Yes.
So you give them the treatment options. You give them the option that your teeth are discolored, but this treatment will not work for you.
Yes.
A simple cleaning will not work for you because this discoloration is permanent. So if we are to sort it, we have to do more of a permanent solution. So most times they come in, many of them, but unfortunately some of them are cut off because of the costing.
Yes.
Dental treatment currently in Uganda is like not one of the cheapest.
Yes.
Yeah, so really we give out the knowledge, you educate the patient, what they really need, what will work for them, what will improve their confidence.
Yes.
And the choice now is left to the patient. But on average, many of them come.
Yes.
Many of them come because of all these problems.
And I agree, because your smile is really what welcomes everybody. It opens doors. So I would definitely come in for a checkup if I had some missing teeth,
Of course,
or some discolored teeth.
You are watching the Doctalk Show.
It's time to learn. Schools are open. As a student, school life is going to be different. You must follow the COVID-19 prevention measures, which include always maintaining a 2-meter distance from others in class, dormitories, entertainment halls, school vans and playgrounds, regularly washing your hands with soap and water, wearing a washed and clean mask that covers your mouth and nose every day, and encouraging your classmates to do the same. Your teachers will also guide you on how to follow SOPs. Don't engage in violence with other students. Report any cases of abuse by teachers or other children to a senior teacher. Those who don't follow the rules should be immediately reported to a class teacher for correction and further guidance. If you experience flu-like symptoms such as a sore throat, fever, dry cough or body weakness, immediately seek medical attention from the school nurse and inform your class teacher. Whenever you sneeze or cough, please remember to cover your nose and mouth with a bent elbow, tissue or handkerchief. Let's share knowledge, not COVID-19. This message is supported by the Ministry of Health, Ministry of Education and Sports, and UNICEF. Stay safe.
You are watching the Doctalk Show.
Welcome back to the Doctalk Show. This evening we are discussing cosmetics in dentistry, and I'm privileged to have Dr. ANONYA Deborah of Debino Clinic, Dental Clinic Isasi in studio. We've been discussing about the importance of having the perfect smile and its relevancy to people's confidence and how they can actually thrive in life, yeah, because your smile is like the door to your heart. I have just coined that word. Yes. So there are people with missing teeth, missing parts of their teeth. Some people have like 5 shades of color in their teeth. Other people have abnormal smiles. Some have cracks in their teeth, and we actually have options for them, yeah? So Dr. ANONYA, what are some of the things that we can do for the different reasons to why people are visiting you to sort out their smiles?
Thank you. Now, cosmetic dentistry is a very wide, with no like clear cut, but what keeps guiding us is the fact that someone wants to improve their smile and wants their confidence back.
Yes.
So depending on the problem, we give the solution according. So if someone comes because of discolored teeth or cracked teeth, we can give them different options. There is what we call tooth-colored fillings, of which tooth-colored fillings, the most commonest is composite. Composite is a tooth-colored cement.
Yes.
But you know the issue with cements, with time, they can take up stains. And maybe we can have a recycle of someone saying, the tooth is again discolored. So you give the different options, and the different options also come at a different cost.
Yes.
Okay?
So let's say, as someone has a missing tooth, what are the options that we have that we can give them?
A missing tooth, we can give the option of crowns and bridges.
Yes.
A bridge, from the word the bridge, it's something is missing here and it gets its support from the neighbors.
Yes.
So there is the missing tooth replaced with support from the neighbors. That is a bridge. It can be tooth colored, because remember we are looking at beauty. It can be made of different materials. In practice, we have the commonest material called porcelain. Porcelain, everyone knows, it's a tooth-colored material that is used to replace
the bridge. Yes.
Yes, and also to improve the smiles. Depending on the shade that the patient wants and the shade of the teeth that are present that are good,
Yes.
we match the shades of the natural okay teeth with what we are replacing, so that the smile is even.
Yes.
Okay, not someone having a lighter shade, then you give them a bridge of a darker shade.
Yes.
Cosmetics
Actually,
is about a smile that is even and that is unrecognizable. Like if I replace my smile with this bridge, someone shouldn't know that I have an artificial replacement.
Yes, I actually do have a friend. While we were growing up, he lost a part of his tooth, and when I met him like 7 years later, he had perfect teeth, and you couldn't tell that he had something added. So for people who are having just part of their tooth missing, what options do we have for them?
Yes. Now, depending on the part, there could be just a small chip that needs just simple cementing. Or it could be a crack that is really evident and it needs the entire cover of the tooth. That is a crown. Okay?
Yes.
A crown is a cover. I don't know if the camera can bring this closer. It is a cover that covers the entire tooth. Depending on the material, the tooth is shaved around, and a tooth colored perfectly matching with a neighboring tooth is made to cover that particular tooth. That is if the tooth doesn't need any treatment. But there are occasions where you find the tooth is really broken, that even the nerves are exposed. Before you put these long-lasting solutions, it's very important to treat the tooth.
Yes.
Okay?
Yes.
So it's important to do this long-lasting solution, the crown, when you're sure your tooth is very fine on the inside. Not covering it, and 1 year, 1 month, 1 week down the road, the patient is complaining of pain, infection. So it's very important, especially for cracks and broken parts. It's important to assess the tooth fully, that it is fine, before you give it the beauty.
Yes. So
otherwise, you find yourself redoing the process.
Yes. Yet cosmetics, I think, is expensive.
Of course, it's not cheap.
I have an exciting question from our viewer. They have commented about my white teeth. Hey, thank you so much, viewer. I am really flattered. And their question is, how can they have white teeth? They have discolored teeth. So how can they get from their discolored teeth to have teeth like mine?
Now, discoloration is in types. They can have discoloration that is on the surface of the teeth.
Yes.
That is what we call extrinsic stains. They could be just stains from tea. They could be stains from coffee. Smokers' stains can really be gross. So for extrinsic stains, just a simple cleaning. As long as the natural teeth are fine, you just need simple cleaning.
Dr. Anonya,
yes, please.
For those simple stains, allow me to ask, are there things that I can use at home that can support my tooth whitening journey? For example, if I came to you and I cannot afford the procedure in your clinic, are there some things that are common, like I've seen people use, I think, bicarbonate of soda, charcoal, and things like that that I can use that can support my whitening journey? Common things.
First of all, we haven't yet talked about whitening.
Okay.
Yes. Now, whitening comes in if someone has natural teeth, the teeth are fine, but they want a shade lighter. Like someone feels like their teeth are darker than a particular shade.
Yes.
So whitening is more like bleaching the teeth. Unlike dental cleaning, which is just professional scaling and polishing. Whitening is sorting the entire tooth with a chemical, of which that chemical also includes sodium bicarbonate in it. But the home usage, you can use baking soda. You can use charcoal. These days now there is charcoal in toothpaste.
Yes.
Colgate has that charcoal paste, which is good. Yes, and basically using pastes that are not just only toothpaste, pastes with a rougher consistency on them. But also you have to put in consideration that the rougher the paste, the more sensitive the tooth.
Okay.
So it's not good to overdo it.
Okay. So we have to do
because
it in
our
moderation.
teeth are protected with what we call enamel. But every time you erode it, you expose the sensitive part of the tooth, which is not good. You might be sorting one problem and get another problem, which is not good.
So we have to do it in moderation.
In moderation, but it's always important to seek professional advice, because you might be using a stain remover at home, yet actually you have what we call intrinsic stains. Stains that are already part of the tooth, in that however rough you will, however much you struggle with it at
brush
home,
your teeth, yes.
you make them rougher, but you will not change the color.
Yes.
Because the color is changed from the inside.
Yes. So for clients who have the intrinsic discoloration, what options do you have for them?
Yes. Now, there are clients who probably, when they were growing up, they had an experience of taking a lot of salty water. People who stay in mountainous places,
yes.
places that have streams that have fluoridated, a lot of fluoride in water, they will get what we call fluorosis. This is a yellow tint in the teeth. So such teeth, a patient will come complaining that I have tried whitening, I have tried dental cleaning, but nothing has changed.
Yes.
So the entire tooth needs to be covered. It can be done with what we call veneers. Veneers are like crowns, but they are half. They only cover the smiling surface of the teeth.
Yes.
So the tooth is just shaved a little, and a small, more like in a simple language, a half crown is fitted on the surface of the teeth in the color that is desirable. Okay? Then it can, the entire tooth or the smile range, if a person has like the entire mouth full of fluorosis, that is yellowing. The entire, we can look at the smile range. Most times people smile from the canine to canine.
Yes.
Those with the wider smiles can be from premolar to premolar. Let's say first premolar or second premolar to second premolar. So we look at the smile range and we advise.
Yes.
We can fit them with veneers or we can cover them purely with crowns.
All right. Thank you so much for that, those wonderful cosmetic options that you have shared with us, Dr. Anonya. Shout outs to our sponsors for the Doctalk show, the National Medical Stores, and Cameline Men's Collection. Thank you so much, NMS and Cameline Men's Collection, for bringing to us the Doctalk show. You can get us on our YouTube channel, the Doctalk show. Please get the link and share it with all your colleagues so that they can be able to have this information arrive to them at wherever they are on our YouTube channel. But you can also find us on our Facebook page. The Twitter handle is the Doctalk show. Thank you.
You are watching the Doctalk show.
Where does it come from? That thing that makes us Ugandan. That thing that makes us different from everybody else. Where does it grow infinitely? Some say it's in our history, in our culture, and in our hearts, in our warm smiles and vast miles of coffee, dairy farmland, and amazing maize fields. It's in our inherent pursuit to always be better, to never stop growing and glowing. So you see, we are more than just a waving flag. We are a nation of sweat and skills, a nation of ideas and inventions. But what truly makes us Ugandan is our quest to improve the quality of life for Ugandans by creating sustainable jobs, businesses, and improving household incomes. That's what makes us Uganda Development Bank.
Uganda Development Bank, inspiring development.
You are watching the Doctalk show.
Welcome back to the Doctalk show. I hope by this time you have shared the link with everybody in your phone. Like really, you can even create a Facebook live view, and share with everyone. Thank you so much for sticking with us. This evening we are discussing cosmetics in dentistry. Dr. Anonya, we have had such an enlightening discussion, and I'm wondering, I have like a few friends, and I think this year I can choose to invest in people's smiles. What would it cost me? I want to, people are getting married, I send them to the clinic to have a perfect smile as a gift. It's your birthday, I send you to the clinic. What would it cost?
For costs, really, depends on the procedure. Like I said, in case of replacements, let's say crowns and bridges, they are different materials.
Yes.
As long as it's tooth colored and resembles your natural teeth, the cost will depend on the material.
Yes.
There is material that is cheap, there is material that is moderate, and there is material that is slightly costly.
Yes.
But also the procedure in
The length
making
of the
the length
procedure.
of the procedure. These days with technology, with advanced technology, procedures that used to take a week to achieve a perfect smile
Yes.
can be achieved in just hours.
That's amazing.
Yes.
Like I can wake up, make an appointment with you, and I live with a perfect smile.
You live with a perfect smile.
Perfect.
But definitely that procedure will not be as cheap as the one where you come, let's say, twice.
Yes.
So the cost is really dependent on the procedure and the process and the time.
Yes. So our viewers, the cost of you achieving a perfect smile is going to be dependent on the underlying problem that you have and the option that you're actually going to choose, as of course, as advised by your dentist and dental surgeon. Of course, it is important here. I understand that I come to get a perfect smile and to boost my confidence and to be able to take on those roles and responsibilities that I might be afraid of taking on because I fear to smile in public.
That is true.
I believe there should be some issues with cosmetic dentistry. What are some of the things or problems I should be aware of? It could be maintenance, that maybe I have to have a dental checkup every year. What are those other challenges or things that I should actually consider before I come in to achieve a perfect smile?
Okay, now definitely a dental surgeon who is informed has to tell you the positives and the negatives of a procedure. You weigh the options, then you choose which one will work for you. Now, depending on what procedure is being made, some procedures, let's say crowns and bridges, will require a patient to take extra care. Obviously, nothing beats the natural.
Yes.
I will say this over and over, that we have to take care of our teeth.
Our natural teeth,
especially
yes.
if you know you have nice teeth. Take good care of them so that you avoid scenarios that will send you to a dentist to have your teeth corrected. But in a scenario where you need a correction, depending on the procedure, like crowns and bridges, a dentist will advise that after this, these are artificial teeth. They are not your natural teeth.
Yes.
They are artificial because they were made to help mimic
the natural.
So nothing beats the natural. That
teeth.
Everyone should know.
Yes.
That's why some of these procedures have guarantee. Let's say crowns and bridges, a dentist will tell you that it would be good to at least pass by the dentist every year for a review, for a cleaning, because anything artificial can take up stains more than the natural.
Yes, so it is very, very important that as we go to the dentist to have our smiles worked on so that we have an artificial but perfect smile, we get to know that we will require to visit and keep in touch with our dental surgeons and our dentists often, because these are not our natural teeth. These have been put in place to accentuate or to make us look better and feel better. It's really cosmetics, so it will require maintenance. Dr. Anonya, this has been a wonderful, I'm really considering if anyone is serious and they have a tooth problem, Valentine's gift is going to be an appointment with you. But before I pay, I would like to know, and I'm very sure all our viewers would like to know, what is the process usually like for someone to achieve a perfect smile?
The process obviously depends on the procedure. For simple cements like composites, those are one-off. They will not take long. But for procedures like crowns, with advanced technology, it is important to know the patient's smile before. It is always, for cosmetics, it is always important to have the before look. So it is important to take photos. Of course, I'm talking about professional dental photos, not just a pose. You take a professional dental photograph of the patient's smile so that it guides you on what they want. There's what we call study models. It's like a duplicate of the patient's mouth.
Yes.
Study models can also be taken before. And the shade.
Of the patient's teeth.
Yes. We are made uniquely by God that we don't have the same shades all over the world. Your shade of teeth is not the same as mine.
Even the shape.
Yes, even the shape.
Yes.
So there is what we call shade guides. A shade guide is like a collection of different tooth colors.
Yes.
That you just pick one and sit against the patient's natural teeth that they are happy with. Let's imagine we are doing a crown. A crown is like a single tooth. Then the person is happy with the others. Okay?
Yes.
So we shall get our shade guide. Our shade guide and pick and compare with the natural teeth neighboring the crown that you want to do before you start anything.
Yes.
Okay? Then after that, you have your before picture. You have your before models.
Yes.
Of the smile.
Of the smile.
Depending on the procedure, there could be some local anesthetic numbing of the place because a tooth has a sensitive part.
Yes.
So it's not good to just go and work without local anesthesia. So after you've given your local anesthesia, there are special instruments that are made to modify the tooth into a shape that will accept a crown.
The crown, yes.
There are instruments called bars on a handpiece that a dental surgeon uses to shave the tooth. Depending on the material of the crown, depending on the type of the crown, there are studied methods of shaping the tooth.
The tooth.
The way you shape a front crown is not the way you shape a, let's say, back crown, because there are different shapes. So all that is a knowledge to the dentist, okay? But as long as the tooth is shaved to the desirable size, remember, we have to be sure that this tooth is okay. If it is not okay on the inside, it's important to treat it.
Yes.
Okay? Because the crowns are permanent procedures. You wouldn't want to do a crown when the tooth is sick on the inside. So I am assuming that we have sorted our tooth in case it is sick on the inside. That is with root canal treatment. That is something for another day.
Yes.
So when you've shaved your tooth, you take measurements. Now the measurement step can be, you follow technology with this advanced technology where we use a scanner. A scanner can scan the prepared tooth and send it to a computer. Or the conventional method where a dentist uses a paste called alginate in a bowel. They mix the paste and capture
the shape of
the tooth. The paste hardens into a rubber kind of material and you put it aside. That is the measurement that will be sent to the lab.
Yes.
With the proper shade of the tooth that you want, the proper type of crown that you want. If it is advanced technology, once you scan this preparation, it is sent on the computer. There's a software. These days we are living in the era of softwares.
Yes.
There's also softwares that design teeth depending on the type of tooth that you want. The software will give you the design. You will look at it as the dentist, happy with it. The shape, in case the patient needs a gap, you leave the gap. all that are specifications
That
in the
can be
design,
made, yes.
okay? Once you design it, there's a process called milling. The crown can be milled in the lab. I'm now talking about the crown that can be done in one day, okay?
Yes.
Then there are those crowns that are built step by step in the lab, physically. So depending on the process and the price attached to it, we go by the process.
Wow, that is very, very awesome. I am actually super excited about the fact that we can walk into your clinic and have our teeth sorted and walk out because there is technology and we can have all these things done. Thank you so much for sticking to the Doctalk show. In our next segment, we are privileged to host the melanin queen, the short hair girl, who has had the privilege of having a cosmetic dental procedure done on her to achieve a perfect smile. You do not want to miss this in our next segment. Catch you.
You are watching the Doctalk show.
Mirinda. Grab yourself an ice-cold bottle of Mirinda Orange at any shop or supermarket near you. Mirinda Orange, the taste that makes you go OMG.
You are watching the Doctalk show.
Welcome, Bettina, to the Doctalk show.
Thank you so much for having me. I'm happy to be here.
I told ya, she has such wonderful hair, a very rich skin complex, and a perfect smile.
So happy to see you here, Doctor.
Happy to see you too, Bettina.
Yes, by the way, those who don't know, she is my doctor here in Uganda, aside from my other doctors, my dental doctors in Turkey. And I'm so happy to be on the Doctalk show, and I'll be sharing with you guys my whole experience with my 20 Emax crowns.
Wow. I must confess, you look very, very, very beautiful. You should be the perfect, ambassador for perfect smiles in this nation. Yes, I must confess. You are for cosmetic dentistry in Uganda. Why did you choose to go for this procedure?
I've always wanted to have a beautiful smile, and as I say, she's my doctor. I always consult with her what to do, and I wanted to do teeth whitening, but we saw it fit to do the crowns since they are durable, they last longer, and they would help me achieve that perfect smile. I did not have well-aligned teeth, and that's why I opted for that procedure.
Dr. Anonya, what are some of the issues that you identified with Bettina's smile that made you advise her to do the different procedures that she did?
Bettina came in, okay, before we were more of working on improving her smile. For all those who know, she's a model, yeah. So she really wanted the best of the best. She had slightly malaligned teeth, though they were beautiful, but she really wanted the best. So, of course, whitening wouldn't really sort the look because it sorts the shade, but with the cons of whitening, with time, the teeth go back to their previous shade. So she wanted a constant beauty.
Yes.
Okay? So when we weighed options, we looked at Emax crowns. These are the modified porcelain crowns, more long-lasting and more sparkling. Okay?
Yes.
Yes, that is what she opted for.
Yeah.
Thank you so much, Dr. Anonya. And it's amazing that in the previous segments that we had, we discussed the fact that usually your solution has to be tailored to the problem that you have. So some people might just need to, you know, have their teeth whitened, and for others, they may need additions like crowns. So Bettina, kindly take us through this procedure. Where did you do it from?
Yeah.
What was the experience like? Yeah. And how much did it cost you? Because girl, you look very nice.
Thank you. So my procedure was performed in Turkey, Izmir. That's a city, another city in Turkey, and it was carried out by Prime Dental Turkey. They have branches all over the world. In West Africa, they have a branch in West Africa. They have branches in Europe and in the UK as well. So I opted for the one in Turkey, and I mean the visa was easy for me since I have traveled to Europe and North America. So I opted for the one in Turkey, and I would say my flight there was quite easy. It was a smooth flight, and what I liked about Prime Dental Turkey is that they offered a hotel as well. So for our Ugandans, we know Ugandans are not people that are extravagant when it comes to such situations or things. So I love the aspect of them providing for me accommodation. So that was sorted. I wasn't stressed over that. The other thing that was left on the table is for me to have my appointments with the doctor. So I was really welcomed well in Turkey by the team at Prime Dental. You know, people in Turkey, not many of them actually speak English. They speak Turkish. I was well welcomed at Prime Dental Turkey, and I had a coordinator who would help translate for me what I wouldn't understand or what the doctor wouldn't understand, seeing that Turkey, they don't speak English quite that often. They use their language. Well, the first step for me was having an X-ray. An X-ray is very vital, so your doctor can see how your teeth are aligned, if you need any other procedures apart from the crowns that I did. So I was in Turkey for about 6-7 days, but the whole procedure takes about 3 or 4 days.
So why did this procedure take 3 to 4 days? What were the different steps that made it to be segmented over 5 days?
All right, so first you have the X-ray. That's a day of its own, and that is when you meet your doctor, discuss your needs. Now for me, my need, my very important need was to have well-aligned teeth, and also to have a brighter smile, seeing that I'm always in front of the camera and I need to look appealing. So that was like my #1 need. So that was what we did on the first day. And then also after that, I went in for another procedure. Now that procedure is where they do the shaving. So for the crowns, they need to shave your teeth down. That way the crowns fit better and you have the well-aligned teeth. Now for me, my teeth were not well-aligned at all. That was something that was, you know, making me very insecure about my smile. And that is what we did on our second visit. We did the shaving, and after shaving, they do give you the semi-permanent crowns. And the procedure wasn't painful. It was just a little bit discomforting because there is the injections, there is taking up the measurements, like you guys will see. It was a little bit uncomfortable but not painful as well,
which is very important.
I always tell her I'm so scared. I fear needles. I hate pain. I dread pain. So I was really happy it wasn't that painful. It was just a little bit discomforting, and they give you a painkiller to calm you down, and it really works.
So that you get your teeth measured. You have them scaled down.
The stamps measured.
And the shaving as well. It was really important because my teeth were out. They were terrible. She says it wasn't bad, but they were so terrible. So that the third visit is when we fit the crowns. And I was like, whoa, this is so amazing. I was so happy. I was really happy. And that day is very important because you get to fit on your new crowns, but then also you get to see, you get to feel, you have to feel comfortable in your mouth. So whatever I thought wasn't okay, the doctor was really, he was really nice. He listens, he will correct it there and then. If it needs sending back to the lab, they take it back to the lab and they would work on it, bring it back by evening and keep on doing the fitting. So that day is very important. You have to go back to your hotel with the new crowns. get to experience them, get to eat with them, and really feel if everything is okay. So for me, everything was okay. There was nothing really to go back and change. And yeah, that was it.
Oh, easy like that. So, Dr. Anonya.
Yes, please.
I think for me the takeaway is the fact that this procedure can be done and it is not painful, and actually the after effects are so amazing. I can't tell the crowns from the
I'm saying it's important to see the before.
Yes.
When you see the before photography, you appreciate the new.
Yes.
Okay? You appreciate the new look. So those who knew her before and now see her, they definitely see the difference about her smile.
Do you see the difference?
Obviously.
I'm glad you do.
Smile before, yes.
Yeah.
So it is really exciting to see that someone's confidence, you can even see from the glow of her smile
Exactly.
after the treatment. So definitely the positives are overwhelming.
Yeah.
Okay.
Oh, another thing I didn't say actually, the doctor is very attentive. That's one thing I liked about him. He noticed that my gum was not, there is something that was not okay with my gum. I don't know if it was really like not straight as well. So we did laser. He did a simple laser treatment.
That is gum contouring.
Yes,
Yeah.
gum contouring.
Shortening it a bit or lengthening, depending on the need.
Yeah. So he really did that. I could literally, in my mind I was wondering, what is he going to do with the laser on my gum? It was very scary, but then it was not painful at all, and I am really, really happy with my results.
Wow, that is so amazing, and it's amazing that these things are possible in Uganda too. You can visit the Bino Dental Clinic in Kisasi. How are your new teeth, Bettina?
Well, I love that they're really easy to take care of.
Yes.
I can floss easily. I love that. And when you take care of your teeth, you floss, you brush your tongue really well, you take care of your teeth, you brush 2 to 3 times a day. It really just gives you like a fresh, breath. That's like super amazing. So people who also have issues with that, I feel like the crowns will also really help you because you can easily clean through. And I just love my new smile. I can't stop smiling.
That is so wonderful. Dr. Anonya was your dentist. Yeah, she did your pre-procedure images. She actually offered the options. Why didn't you do it at the Bino or any other place around?
Okay, so I love to support women, and mostly I love to support Uganda. I love to support Uganda so much. If you follow me on my social media, you would know that. Well, many people may know that I'm a content creator, I'm an influencer, and I work with international brands and global brands, and my management really does a good job with connecting me to different organizations or companies to work with on an international basis. So the opportunity presented itself to work with Prime Dental Turkey as an influencer. That is why I even have a discount code. When you go there and use my name, Bettina, you get $300 off your procedure. And as I also love to travel, so it was like a 2-in-1. I wanted to see Turkey and then also get my perfect smile. So it was just a whole different experience, and that is what most people do when they go to Turkey. They go get their teeth done, and then they can go shopping and also take pictures, tour, and experience different cultures.
Dr. Anonya, before we close, maybe you could provide some post-procedure instructions and caution to Bettina, but also to our viewers who are out there who would want to have cosmetic dentistry done for them. What are the things that they should do after the procedure? How should they take care of their teeth so that they can continue to have these amazing smiles?
Basically, like she said, she brushes twice or 3 times a day. The artificial teeth, actually cosmetic teeth, should give you a natural feel. Like with time, you have to feel like you're you.
Yes.
Whenever you have the thought that I'm on artificial, it might be a bit discomforting to your psychology. So it's about you getting used that now this is my new look. You love it, you take good care of it, you floss, like she said, you brush at least twice a day. And it is also important to have at least some routine reviews. Maybe once a year, you visit a dentist like she. Obviously, we are going to be in touch with her. Once in a while, you do general cleaning by a dentist, like any normal person. As long as you're more conscious and more careful about your teeth, like any ordinary person who loves their smile, you have to take good care of them.
Yes. Also, maybe one thing that I should say before we round up or close, guys, if you want to have this procedure done, I mean, there are so many different options, but if you opt to go to Turkey, make sure you check out Prime Dental Turkey. And I have a discount for you. If you're going to Prime Dental Turkey, you get to have a $300 discount off your procedure. And yeah, so you guys should really take advantage of that. You can contact me on my Instagram at Bettina Tiana, and I'll give you all the details. And yeah, let's all have beautiful smiles.
Oh, thank you so much. Thank you guys for watching the Doctalk show. Thank you to our sponsors, the National Medical Stores and Camelin Men's Collection. Please go shopping at Camelin Men's Collection. Until next time, the Doctalk show. Dr. Nagadia is my name.
The Doctalk Show.